Hello guys, Assalamu alaikum. So the first topic which I selected is a common condition, diarrhea, which is common in our countries like Pakistan, India, and most of the time parents will be worried about the loose water stools, and they will go to the doctor and will insist for antibiotics and medications. But solution is most of the time is very simple. So like in most of the diarrhea, they are viral, so they just need sportive care. With sportive care, I mean just need oral rehydration in the form of ORS, which you can get over the counter in any pharmacy. And along with that, you can encourage the child to take special soft diet, like the child is of infant age, around 1 year or 2 years. You can give some yogurt which has naturally got probiotics. You can use over the counter probiotics, but when the natural yogurt has got probiotics, so it's simple. You can use yogurt. Banana has got potassium, so in diarrhea the potassium content inside the body can be less, so the banana is the best diet for potassium. And along with that, you can use white rice, boiled rice, and simple measures can avoid dehydration and diarrhea. So most of the time, would we our children don't need any kind of antibiotic in diarrhea. So for example, if the child has got diarrhea and along with some vomiting as well, so if you try ORS after every loose motion, even the vomiting will be stopped after rehydration. So if there is a low grade fever, you can use paracetamol for that anyway. So most of the time you will not need any major kind of treatment, and sometimes people are very much worried the child has got diarrhea, what will happen. The only concern which we have for the children is the dehydration. So to avoid dehydration is the first line of treatment. And if the child gets dehydration, definitely they will need kind of therapy in the form of IV drip, intravenous solution, for drip solution, and sometimes some nasogastric tube in the form of a tube which goes through the nose and to the stomach. But to avoid these hospitalizations and these stuff, the simplest thing is the ORS, which you can get over the counter nowadays. Low osmolar ORS is also available in the pharmacies in Pakistan, so you can get over the counter. Low osmolar ORS is recommended by WHO, so it can be used for diarrhea. So this is the main treatment for diarrhea, and usually it takes a few days for diarrhea to get resolved, and afterward you just continue with the normal diet. And definitely, child has got a high grade fever and in diarrhea there is a blood or something, yeah, definitely you need a consult with the local pediatrician or child specialist. Otherwise, most of the time diarrhea gets resolves itself after a few days. And when vomiting is there, you can one or two vomiting, you don't need to worry, you continue using ORS. And if vomiting is persistent or something, then definitely you need to go to the nearest child specialist for that. So if any question, you can ask in the comment section. Thank you very much.